Thank you for joining me today. So today we're going to be looking at a hamstring injury prevention strategy proposal for our football club. And it's going to be based around the findings in Timmins, Bourne and Shield article that we've all read. So the key takeaways from the article for me were around risk factors, particularly the eccentric knee flexor strength and the bicep femoris long head fascicle length. They seem to be two real key identifying risk factors that can be modified, monitored and changed. Okay, so how do these findings help us? So what are we going to do with these findings to adopt a best practice approach in terms of injury prevention? So using the Van Mechelen injury prevention cycle, we're looking at establishing the extent of the injury, then looking at the mechanisms of that injury, so why they occur, introducing the preventative measure, which is the key to this presentation, and then we will briefly look at how we assess the effectiveness of this. So when establishing the extent of the hamstring strain injury, really we're looking at the development, performance and financial implications. So in terms of development, obviously has both physical and mental impact on the players, and it will affect their individual performance when they return, as well as the team performance with them not being there. But financially, so if we're 1 in 5 players is getting injured per season, so if we have a squad of 20, 4 of those players are getting injured, average time lost 17 days per injury, and that each injury costs the club €280,000. Now across a season, that's a huge financial outlay on the club for players that are unavailable for selection. When establishing the etiology and the mechanism of hamstring strain injuries, they're most common in the late phase of high-speed running. Now, there's nothing we can do about high-speed running in our sport. It's a significant skill, and it's a huge part of it. But we can do something when we look at the etiology of it. So it's multifactorial. So non-modifiable factors of age and previous injury, again, we can't do anything about these. However, the modifiable factors of like hamstring strength and hamstring architecture, we can absolutely do something about. So our preventative injury measure should be around the structural architecture of the bicep femoris, long head fascicle length, and the functional eccentric knee flexor strength. Now, prevention is really important so we don't enter that injury, re-injury cycle, which can have a huge impact on an athlete, both physically and mentally. Now, for every half a centimetre increase in bicep femoris fascicle length, we're reducing the hamstring strain injury risk by 73.9%. And for every 10 Newton increase in eccentric knee flexor strength, we reduce the hamstring strain injury by 8.9%. Now, the benefit of strength is that it also increases the size of the bicep femoris fascicle. So it's like a double benefit in the one. Now, with this in mind, I propose that we introduce a injury prevention strategy around the Nordic Hamstring Exercise. So this is the partner-assisted version of the Nordic Hamstring Exercise. You'll see the focus on the eccentric knee flexor strength to lower the body. For a super maximal intensity, the athlete would hold weight on the lowering phase. So the Nordic Hamstring Exercise is highly beneficial and highly reliable. It focuses on both the bicep femoris long head fascicle length as well as the eccentric knee flexor strength. So the two focus points of what we're trying to improve. It's a proven exercise at reducing the risk of hamstring strain injuries, and we're reducing how often that they will occur to our athletes. Now, in the video, you saw the partner assisted. We can do that. That's a very good exercise. If we wanted to look at investing in some equipment, a piece of technology called the Nord board, which is very good for testing eccentric hamstring strength. So we're just going to briefly have a look at some previous studies that have been undertaken around the Nordic hamstring exercise. So this data table looks at the impact of the Nordic hamstring exercise on hamstring strain injury occurrence within a season. Now you'll notice that across all 3 of these studies, the occurrence of the hamstring strain injury within that season was between 65 and 71% lower than previous years, which is a significant improvement. When we look at the impact of the Nordic hamstring exercise on the architectural adaptations, again, multiple different studies, similar intensity in that super maximal used for all studies, but the volume frequency changed. But the percentage improvement of the bicep femoris fascicle length was significant, again, across all studies, showing the high success rate of the Nordic hamstring exercise on developing exactly what we're trying to develop. When we look at this study from Bourne, it was a training comparison on the Nordic hamstring exercise. So I'll draw your attention to the blue, green, and purple dots in this. You can see around that central point of Nordic force at the bottom, kind of halfway between strong and weak, probably around that 337 newtons that we were talking about earlier. But after the study, they've all gone into the strong and long square. So they've increased strength as well as improved bicep femoris fascicle length across the study. Now, the volume hasn't had a huge impact. The higher amount of volume will improve strength, but it won't necessarily improve the fascicle length. So taking these into consideration, as well as the article that we're reviewing, the proposal I'm putting forward, based upon considerations of the literature surrounding the volume, frequency, intensity, and timings of it, would be 2 sets of 5 reps of the Nordic hamstring exercise, which would be partner assisted, 3 times a week at a super maximal intensity, meaning if our athletes can control themselves right down, touching the ground and almost coming back up, we would be increasing the load at 2.5 kilo increments on their body. And these would be implemented post-training so that it is part of our warm down and stretching routine. It would have no other impact, your warm-ups, your tactical and technical coaching elements, or anything like that. And injured players obviously have to be taken into consideration. So they would be reintroduced at a sub-maximal level when they've been medically cleared to do so. And again, this would be built up, going into maximal, supramaximal when medical clearance has occurred. The ideology of this program has come from the studies listed below. So these have been review articles as well as randomized controlled trials, but specific focus in that elite football industry. So as part of the proposal being put forward, it's also very important to look at the considerations around this. So high compliance is essential to this. Many studies have been undertaken, and low compliance rate basically has no structural or functional changes. So no real changes in strength, no real changes in bicep femoris long head adaptations. It needs to occur both pre-season and in-season. Due to the ceasing the exercise, adaptations will begin to reverse after approximately 1 week of not doing the exercise. The eccentric strength decreases at a lower intensity, but the bicep femoral long head has a drastic decline in benefits that have been applied, and both of them will return to a base level within that 4-week period. So ceasing exercise basically throws away all the work that the players have put into this. It is also important to consider that the Nordic hamstring exercise, it's not going to impact the severity of a hamstring injury that a player suffers, or completely prevent hamstring injuries from occurring at all. This is a significant consideration of all academic literature that has come out. You can't determine the severity of what injury will occur, or the length of time that a player is going to miss because of injury. Now, when we look at assessing the effectiveness of the study and the proposal being put forward, I would suggest a lot of data collection. Data will be fundamental to working out how successful the program is, looking at individual player knee flexor strength as well as bicep femoris long head fascicle length, comparing injured to non-injured players during a season, so comparing their strength and their fascicle length, comparing seasons across one another, both as individuals and team cohorts. And within all of this, we'll be looking for trends of where and who is suffering injuries, when injuries are like to occur. So if it's around a loading issue, we can obviously impact that and change that. If certain players show weaknesses, we can adapt what we're doing with those players to ensure they're getting that eccentric strength and they are building the bicep femoris long head fascicle length. Thank you for allowing me to put forward this proposal, and I look forward to hearing back from you. These were the academic references that were used as part of my proposal. Thank you.